on the menu of quality program options at the CPSO available for physicians to participate in and meet their quality requirements. My name is Ted Everson, and I'm a medical advisor at the college. I'll be co-hosting with my colleague, Dr. Mary Manno, as well as our program manager, Ms. April Jacobs. Dr. Manno, do you want to introduce yourself?
Sure, thank you. I'm a family physician by training, and I've been at the college for the last 3 years, leading the QI program for individuals. Very pleased to be here today. Thanks, Ted.
Great, thanks, Mary. We are fortunate to have a guest presentation today by Dr. Suzan Schneeweiss to speak about the University of Toronto IDEAS program. Dr. Schneeweiss is a professor of pediatrics and associate dean, continuing professional development in the Temerty Faculty of Medicine, University of Toronto. As associate dean of CPD, she promotes the academic mission of the largest CPD office in Canada. She's a staff physician and director of education for the Division of Pediatric Emergency Medicine at the Hospital for Sick Children in Toronto. Dr. Schneeweiss is a graduate of the University of Toronto Faculty of Medicine and also holds a Master's of Health Professional Education from the Ontario Institute of Studies in Education, University of Toronto. As an academic program director and conference chair for a variety of CPD programs and conferences, she's acquired a broad range of experience in the complexities of program development and has been extensively involved in teaching. We're excited and really fortunate to have Dr. Schneeweiss here to speak about the IDEAS program, which is a program that can engage and support physicians in doing quality improvement. In terms of our format today, we're going to start with our slide presentation. We'll initially cover the CPSO quality program content, and then we'll transition into the IDEAS presentation by Dr. Schneeweiss. We'll try to save questions until the end, and we'll definitely leave some time at the end of the slide presentations for some open discussion and to answer any questions. You can certainly insert your questions into the chat. If it's straightforward, we'll maybe respond real time. Otherwise, we'll track and save and get into those at the end of the presentation. This webinar will be recorded and saved to our website and as well to our CPSO YouTube channel, where you'll also be able to find previous quality webinars. And with that, let's move on to our November 2022 QI program webinar. In terms of learning objectives for our webinar today, we're going to review and explain the transition from quality assurance to quality improvement at the CPSO. We'll review and describe CPSO tools that can support physicians to do self-directed quality improvement. We'll review and discuss the 2023 quality improvement program options that are going to be available for physicians. And then we'll describe the University of Toronto IDEAS program that is available as a resource and to help physicians participate and do quality improvement. Start with some background on quality at the CPSO. I'll bring to your attention a couple of the important principles for our work at the CPSO, one being quality of care, and the other being something called the right touch regulation, which you may not be as familiar with. For quality of care, we certainly want to support physicians across the province in providing high quality medical care to their patients. For right touch regulation, this is something that we use as a framework to guide our work in almost all areas that we are active in at the CPSO, whether it's within our quality programs, whether it's within registration and licensing, within policy development, or within complaint investigation. And what right touch regulation is really a framework based on an evaluation of risk to determine the appropriate level of our involvement in a particular area or in a particular matter. And this has definitely helped to guide and shape the current state of our quality programs and the options available for physicians. For quality at the CPSO, there is an expectation and requirement for all members with an active license to participate in quality. And historically, this was through our peer assessment program. Starting in 2019, we underwent a redesign and have transitioned to be able to introduce quality improvement based options for most of our membership. The peer assessment program does still exist and remains an important tool for our various committees. Some of the background on the transition and the change, up until 2019, we had been doing approximately 3,000 peer assessments a year. And in 90% of those, there were no problems or issues that were identified. And I think there's a couple of important points and takeaways from that experience. One is that we know that physicians in Ontario are generally practicing at a very high level, which is great. The other takeaway is looking at what is the value that we're providing with our quality program and how could we provide more benefit to physicians that are participating. I think this slide outlines the potential benefits with the transition from a quality assurance approach, which is what the peer assessment program is based in, to transitioning to a quality improvement approach. So with quality assurance, and this is the experience with our peer assessment program, we're assessing to see if physicians are meeting a minimum acceptable standard. And ultimately, this is having an impact or any action with a small number of individuals. Whereas with quality improvement, we know that even for a group of physicians that are practicing at a very high level, by participating in quality improvement, there's the potential to have a bigger impact and shift on quality because everybody can make an improvement. Again, summarizing the two approaches, quality assurance and quality improvement. And again, the background on our change and transition, quality assurance and our peer assessment program is based on looking at care that has been provided in the past. It's an audit of a physician's practice done by one of our peer assessors. Quality improvement, it's a self-directed, self-guided process of learning, measuring, and improving. And we offer coaching as a means to support physicians. And this is going to have an impact on care that is yet to be provided. So in terms of the current state of our quality program and the quality improvement options that we've developed, we have essentially two streams. One is our quality improvement for individuals stream, in which there's a group subset, and Dr. Manno is going to speak to both of those options. And then we have our quality improvement partnership program for physicians that practice in a hospital, something that I'll go into in a little more detail. Both program options are on a 5-year cycle. So with physicians participating, we wanted to have more frequent contact and interaction with our membership. And for a physician participating in one of our QI streams, it will now be on a 5-year cycle. Excuse me. With that, I'll pass it over to Dr. Manno.
Thanks, Ted. So if we take a look at the first stream, QI program for individuals, this has been in operation now since 2019 when we started out with a pilot program of 260 family physician volunteers. In 2020, an additional 1,700 family physicians were invited to participate. In 2021, 6,000 members were invited, and they included also family physicians as well as psychiatrists, radiologists, internists, anesthetists, surgeons, etc. In 2022, 4,000 members were invited to QI for individuals, and we then developed a group subset, which I'll speak about in more detail in a moment. And we were able to incorporate then physicians practicing in a variety of settings and specialties. In 2023, we've just begun with invitations on November 7th, and we're now going into the 4th year of the 5-year cycle. So those who haven't been invited to date can expect to be invited either at this time or during 2023. And we're also open to those who would prefer to volunteer to do the program, which is always possible. And also in 2023, we have a new QI enhanced pilot that will provide some additional options for physicians aged 70 to 72. And we're going to speak about that in more detail in a moment. Next slide, please. So if we're taking a look at the program QI for individuals overall and the way it works in this 5-year cycle, participants have access to an online program called the Learning Management System, or the LMS. And that contains 3 modules for self-directed learning. Practice profile, which helps participants assess their risk, and in other words, assess factors related to physician performance is, I think, a better way of expressing that. There's also a self-guided chart review and a DDQI activity. DDQI stands for data-driven quality improvement, and it's a way of taking practice level data and applying it for QI purposes. I'm going to give examples of each of those in a moment. Completing these modules will guide participants to identify areas of strength as well as areas for improvement, and ultimately to set a minimum of 2 goals developed using SMART criteria. This is an acronym for setting educational objectives that basically relates to specific, measurable, achievable, relevant, and timely. These improvement goals are then incorporated into a practice improvement plan, or a PIP for short, which is then submitted to a CPSO through the member portal to the CPSO for review by a QI coach. Next slide, please. So a question that I'm often asked is, where do these improvement goals come from? How do you formulate an improvement goal? And so I'd just like to take a couple of minutes to give a few examples. Next slide, please. So thinking about the practice profile activity that is helping physicians to assess their own factors that are relevant to their performance as a physician. Here's an example. I'm a solo physician over the age of 60. Before completing this QI activity, I did not appreciate the impact on patient care and had no idea that I was at an increased risk of a college complaint. This physician says, my goal for improvement is to mitigate this risk and obtain collegial support for my practice of medicine. So in the current state, this physician has identified that they have little or no peer support. And the intervention that he has in mind is to rejoin a problem-based small group by contacting the Foundation for Medical Practice Education. He's also intending to apply for affiliate privileges at his community hospital and ask for an invitation to join the local family physician WhatsApp group. These are the things that he has in mind to achieve his objective, and the way he's going to measure success or the outcome in the future state is in 3 months, he will reevaluate his level of peer support. So that's an example of an improvement goal that came out of the practice profile exercise. Next slide, please. The second online activity that I mentioned is a self-guided chart review, where a physician chooses 5 charts that are reflective of his or her practice and evaluates them using a checklist that is provided, and also has the opportunity to share their results with the trusted peer who can give objective feedback. So in the case of this physician, when we went over the results of my self-guided chart review, my trusted peer noticed that I often neglect to include negative findings in the record. For example, in a 65-year-old smoker, it would be prudent to document that the abdominal aorta was not palpable. So in the current state, 3 out of 5 charts did not include significant negative findings. The intervention that this physician had in mind was to set a reminder, which could be electronic or other, to document negative findings as he goes through his day. And the outcome measure would be to, after a period of 3 months, perform another chart review to see if his documentation had improved. This is an example of an improvement goal that can come out of the self-guided chart review. Next slide, please. The third online activity has to do with data-driven quality improvement. And we've had a number of comments in relation to this, such as, I had no idea that all that data was being pushed to me. And now I know that I can use my screening activity report to create a goal. I can also embed the I4C dashboard into my EMR as a source of data. And it's possible then for a physician to observe their own practice and think about the pebble in my shoe. We all have them as we're going through the day. For example, one physician noted, I'm a therapist and my counseling sessions run late 50% of the time. Another specialist colleague noticed that patients have to wait 2 months to see me in consultation, which always makes me chuckle because 2 months would seem like a good thing right now, but that's a different issue. Then a physician mentioned, I'm a locum. How do I get feedback on my performance in that role? Um, Another colleague, 25% of my patients are prescribed opioids and maybe they'll benefit from deprescribing. And lastly, as a radiologist, I review about 10 interesting or challenging cases per week, but I receive little or no feedback on patient outcomes. So this kind of practice level data could all be used to structure an improvement goal that is then incorporated into one's practice improvement plan. I should point out that the information that members um, track as they're going through these 3 online activities are recorded for the members' benefit, but the actual content of those activities is not reviewed by the CPSO. We look to see that the activities have been completed, but we don't access the content. That's private, that's for your benefit to help you identify your own strengths and areas for improvement. The part that is submitted to the CPSO is the PIP, the Practice Improvement Plan. Next slide, please. I mentioned that there's a minimum of 2 goals required in one's practice improvement plan and a maximum of 4. One of those goals can relate to physician health and self-care. And this is really important because I don't think there are any physicians in Ontario now who are not feeling stressed. And so to be able to reflect on that and to think about ways of optimizing one's own well-being during these difficult times can be a really meaningful and relevant basis for an improvement goal. This physician, for example, looked at the CMA resources online and realized that he could structure a self-care goal for himself. For example, I will leave my office for 30 minutes at lunchtime, at least 3 out of 5 days per week to go for a walk or do some stretching or eat lunch, whatever things this individual felt would be beneficial to helping them get through their day. I'll keep track on a calendar, a check mark for each day that I succeed, and after a month, I'll count my successes and reward myself accordingly. This seems like a pretty simple goal, but when we think about it, it can be really hard to take that time out in the middle of a busy day, but it can be a big part of getting through that day. And these kinds of goals will vary a lot from one physician to another, but I would like to point out that there are some excellent ideas on physician wellness that are available through the CMA and through the OMA. And these links will be put into the chat for those who would like to access them. The OMA physician wellness resources are particularly interesting because there's an opportunity there to use an online survey that can be accessed for a nominal fee that actually allows you to develop a baseline, choose interventions, and an outcome measure so that it's quite applicable to the SMART goal setting approach for those who may be interested. Next slide, please. So when we looked at, I think in 2020, we had about 2,000 PIPs that we reviewed, and the vast majority of those were met the requirements. About 15% needed a little bit more developing, and so those physicians were offered coaching, and this can consist of 1 to 3 45 or 60-minute video conference sessions with one of our 10 quality improvement coaches that could focus on clinical care, practice management, or any wellness issues that were identified during PIP review. Next slide, please. So QI for individuals is the stream that we're talking about right now, and the group subset was piloted last year and has been very successful this year. Next slide, please? This is a way that groups of physicians can come together to participate in the individuals program as a group. So the elements are mostly the same in terms of the online activities that need to be completed, but the difference is that the members submit a group PIP instead of individual PIPs. And this doesn't have to be physicians that are co-located. These can be physicians that come together for various reasons. For example, physicians providing after-hours care in their faux after-hours clinic might decide that there's an opportunity for improvement at the after-hours clinic, and they might structure improvement goals as a group around that. At this point, we are limiting group size generally to 7 physicians for technical reasons, but there can be exceptions, and so this is another option for those of you who will be participating in QI for individuals. Next slide, please. I'm going to hand it back to Dr. Everson now, who will speak with us about the QI Partnership Program.
Great, thanks, Dr. Manno. So the QI Partnership Program, this is another or the other stream within our quality improvement program options for physicians. The QI Partnership Program is really about engaging physicians in doing quality improvement. We know that quality improvement is a great way to improve or change clinical practice. And in the context of the partnership program, we feel that this is a great opportunity to support hospital priorities, whether that's something within an organization's strategic plan, something that is a quality metric that wants to be focused on, or whether there's other things happening at an organization, whether that's wellness related, EMR implementation, or accreditation. And one of the other key elements of the partnership program is the recognition that at many hospitals, within many organizations, physicians are already involved in quality projects and quality initiatives. And our goal is to reduce some of the redundancy, recognize the effort that is already happening, and capture that within the partnership program, and translate that into physicians meeting their quality requirements through the partnership route. The partnership program then is option for hospital-based physicians to participate in a QI project or initiative at their organization. An organization would initiate enrollment by submitting a proposal to us, to our program to review. And by understanding how physicians are participating and involved in quality at their organization or in a particular quality improvement project at their organization, they will be able to meet their CPSO quality requirements for a 5-year period. Similar to a part of the other stream, we provide access to 2 of the online activities for physicians to complete as well. So in terms of the partnership project design, it is flexible. The scope is flexible, and we want organizations to decide on a direction that is important and relevant to them. We want this to align and match resources that are available to support a project or initiative. And in some organizations, we just want to understand and organize what physicians are currently doing for quality activity. So in terms of our experience to date, I think it's understandable, or it can be recognized that what a particular organization may be doing may be different than another organization, depending on size of the organization, ongoing and current quality activity, and certainly things that are important and next steps in terms of a quality metric that they may want to focus on. In terms of moving on to a next step, organizations will submit a proposal to us. This could be a proposal that follows a fairly standard QI project charter for an organization that is looking at drafting and designing and launching a new quality project or initiative for their physicians to participate on. For some other organizations where quality activity is embedded within the organization and most, if not all, physicians are already engaged, we then just want to understand what is the quality experience, and quality activity that physicians may be engaged on. You submit this to us, and our program will review this. In terms of our experience to date, we launched the partnership program as an option in early 2021. And to date, we've had 49 hospitals across the province approved for their quality improvement proposals. Again, there is variation in what organizations are submitting and electing to do. And this can be something that is generally an organizational wide initiative that physicians can sign on to. And we're seeing proposals and initiatives from large academic, large community hospitals across the spectrum to smaller community-based hospitals. Excuse me. This is an example of some examples of what organizations have submitted from 3 organizations. So looking at things such as a reduction in unsigned physician orders, looking at safety around opioid prescribing. Another initiative that's got a lot of interest and is very relevant and timely is the Physician Wellness Initiative. And one organization undertook an evidence-based wellness course that involved trained facilitators and having their physicians attend a number of group sessions. Another organization looked at optimizing their resource utilization and looking at and pursuing the Choosing Wisely Canada Hospital Designation Program. As mentioned within this stream, physicians will be required to complete only two of the online reflective activities that have been outlined previously by Dr. Manno. In terms of next steps, you submit your outline and proposal to us. Our program reviews it and will work with you in a collaborative manner to modify or edit as needed to obtain an approval. Post-approval is when we enroll your physicians and we update them and their status through their member portal. So to summarize some of the key messages and benefits for the partnership program, for physicians, we're hoping that this will decrease the redundancy in the various professional requirements that we have as practicing physicians. So by participating on an initiative at your organization or capturing what you're already doing, you'll be able to meet your CPSO quality requirements for a 5-year period. We do have alignment with the Royal College and with the CFPC, so you'll be able to concurrently claim CPD credits. And depending on your organization, this may support requirements that align with your hospital and or academic reappointment. For hospitals and for the leadership at an organization, I think this is an opportunity for you to engage your physicians on initiatives within your organization because of the additional benefits that physicians will receive with their participation. So summary of the current state of CPSO quality program options. We've talked about our quality improvement activities, our individuals stream and the group subset, as well as the QI partnership stream for hospital physicians. You'll see the participation in the various QI activities that we provide access to that support physicians in self-directed quality improvement. Physicians in the individual stream will submit a practice improvement plan, where physicians in the partnership stream will be listed as a participant on their organization's quality improvement partnership project. Physicians can decline to participate in one of our quality improvement streams and therefore then would be expected to participate in our peer assessment program, and we would organize a peer assessment. Just as an update and new for 2023 is something that we're calling QI Enhanced. And what QI Enhanced is looking at an alternate path for our physicians over the age of 70. Current state is that physicians over the age of 70 are required to have a peer assessment every 5 years. And what we're looking at with a QI Enhanced pilot is an alternate path that is QI based for physicians age 70 to 72. And this is based on 2 different streams. One is QI Enhanced Partnership for a physician that is listed as a participant on their organization's partnership project. And for physicians that are not on staff at a hospital or not participating on a partnership project, they have the option to participate in something called QI Enhanced Individuals. For these QI Enhanced pilot options, again, based on some of the activities that we provide access to within our learning management system platform, participating in the activities for self-directed quality improvement, and then either listed as a participant on a hospital QI project in the partnership stream, or submitting a practice improvement plan within the individual stream. With both paths and both pilot options, we do offer and connect the physician with one of our physician QI coaches. And with that, I will transition over to our guest presenter and guest presentation on the IDEAS program, which can support physicians in doing quality improvement. And I'll hand it over to Dr. Schneeweiss.
Thank you. I'm going to talk about the IDEAS program, or Improving and Driving Excellence Across Sectors, which is a foundational program for quality improvement. Next slide. And I have no disclosures. So a little bit of history around the program. The program was originally developed by the Ontario Ministry of Health in partnership with the 7 Ontario universities, ICES, IHPME, and Health Quality Ontario. And the goal of it was to promote quality improvement and across Ontario. The program specifically provides a common language, methods, and tools to support quality improvement initiatives and collaboration. It helps to promote a culture of quality improvement and accountability, and hopefully spread and adopt evidence-informed practice. Next slide. And more specifically, the program is very practical, and so we follow a case for quality improvement where we apply the principles of quality improvement for healthcare. It helps to explain the quality improvement aim statement in accordance with the model for improvement, and also looking at a variety of application tools and measurements in accordance with the model for improvement. And we know that quality improvement is a team effort, so it helps to promote collaboration with interprofessional team members to contribute effectively on a QI team. Next slide. So just an overview of the program. The program consists of 4 asynchronous e-learning modules, which take around 2 to 3 hours to complete. They're very interactive. And then there is 2 3-hour synchronous virtual workshops. The program is generally in a small group, and generally we have anywhere between 18 and 40 participants in the program. And as I said, it's very interactive. The program is accredited for both Royal College and Main Pro credits. The e-learning modules, which are mandatory, is accredited for Section 3 self-assessment credits. And just to note that if you are a CFPC member, you can collect up to 50 Royal College credits in your 5-year cycle, and then just our website below. Next slide. So just a little bit more about the e-learning modules. They are scenario-based, and there's like little avatars. You get to follow them throughout the program. It explores the roles of the QI team members, and importantly, it goes through all of the basis of quality improvement. So it describes what an aim statement is and what SMART goals are. It also goes through foundational elements of QI, including the model for improvement, and looks at a variety of QI tools, including some standard tools, including fishbone diagrams, 5 whys, process mapping, and PDSA, or Plan, Do, Study, Act cycle. Next slide. The synchronous workshops are divided into 2 half-day workshops, and generally 1 to 2 weeks apart. Again, it describes sort of the case for improvement, so why quality improvement. It follows an improvement story, so a case throughout. It goes through the various elements of quality improvement, including improvement chain aim statements. It looks at some of the measurements in quality improvement and tools with a focus on run charts. Day 2 is really looks at more around, becoming a good quality improvement team member. So it looks at teamwork, it looks at change concepts. Again, we review the PDSA cycle and data collection and what is involved in terms of sustaining change, and then in terms of what is next in the improvement cycle. Next slide. It also gives you access to a whole host of library of tools. And so you can see here there, you can't read it, but you will see there's lots of tools here. There's lots of templates and instructions for the use of tools that you can download and have at your disposal. Next slide. And then in terms of how it links to the CPO's quality improvement, so it gives you a really good understanding of the language of QI. So when we talk about PDSA or model for improvement or aim statement or SMART goals, you can really understand what that really means. It will give you a better understanding of how you can link your own practice data to develop your SMART goals, and then how you can use this model for improvement to help develop your practice improvement plan. Next slide. So we have just completed our fall programming. I don't have dates yet for the winter sessions. So we will have another session in January, February. But if you go onto our website and you scroll to the bottom, you can click on this sign me up. And when we have a new program, we will notify you. And so I just wanted to show a short video about what some of our alumni say about the program, and then I'm happy to take any questions.
Before taking the course, I was already involved in many different improvement projects. The course was really able to consolidate all the information I had and put it all together and really show the method.
It was an awesome experience because you get to hear from the different sectors some of the things that they're doing to improve on the quality of care that they're providing. The terms are very user-friendly, so no matter what discipline you're from, you're able to understand the terminology.
The ideas curriculum was able to really demonstrate how all these processes fit together, and then how you can apply that to the processes that you're involved in.
The fishbone. That was one of my favorites, just to try to gather all the data to see what really is the root of what's happening here. These are tools that we can use in every aspect of our work.
I've been able to take a new look at the way we measure things. Not only do we want to look at the specific goal or aim of a project, we need to look at complementary measures. Just because we've made one little area better, we need to make sure that it's not to the detriment of some other process.
Everything we do is about quality, and it's just improving on the skills that we already have so that we can get better patient outcome or resident outcome for the population that we serve.
Through these improvement projects, you can really affect change in how we treat our staff and how we treat our patients and how we serve our communities.
Okay, great. All right. So the ideas programming, it sounds like a fantastic program. Thank you to Dr. Schneeweiss for presenting on it. I think it dovetails very nicely with what we're hoping physicians will do within our quality improvement program options and streams. And I think it's a great resource. So that's great. Thank you so much. That's the end of our slide presentations, and we can now open it up for any discussion and open it up to any questions. I know that April Jacobs, our manager, has been monitoring the chat. I don't believe there's any questions that are open or pending from that, but we can open it up to anyone attending to ask a question about our CPSO QI programs or about the ideas program. So I'll just open it up at this time. So it looks like there's a question from Harjinder. Do you want to go ahead? You're just on mute if we just have you. You're still on mute, so we're just not able to. There you go. There you go.
Sorry about that. Yeah, so I filled up. I was selected for the QI program, and I filled up the initial questionnaire yesterday, and then I realized that it had said that you can't change your answers once it's submitted. So there were a couple of queries I had because where it had asked for peer discussion about cases and things like that. Now, as you I've listened, I've looked at your previous webinars too, and I guess as you rightly mentioned, all of us have been under some stress or the other in the past 3 years or so. So in my case, I used to attend. I'm based here in Brampton, Ontario. We used to have once a week doctors' education rounds. And so that was cancelled because of COVID. But on the other hand, I've still maintained my, by my age, I'm on courtesy staff at the local Brampton William Osler Health Center, courtesy staff. So I do still attend the webinars on by the various departments, including Department of Family Medicine, Department of Pediatrics, and I think recently we have had a CME by the Department of Medicine at the hospital. So my question is, would that be considered as peer interactions? Because I put no, thinking that it meant like day-to-day, like physical interactions with other doctors. Because my understanding is that that part cannot be changed. So my question again is with regards to peer interaction.
So I mean, I can try to start to answer that. I think are you wondering about one of the activities is the self-guided chart review and discussing with a peer?
Yeah, that's okay. Yeah, kind of. So in previous to COVID-19, we doctors would get together, like I said, for the meetings and on the side, kind of discuss anything interesting, and also we have, I guess, something. I guess you probably know about the SCOPE, SCOPE, which is an initiative to like have early appointments through a certain central number for patients to be seen faster via a caseworker at SCOPE. So
yeah, so I think, I mean, we could maybe try to, I think I understand. So in terms of going through the individuals program and some of the interaction activities, so maybe two things. One is that as you go through the online activities, the one activity, the self-guided chart review, there is a request to review that with a peer and have a discussion and interaction there. So that's kind of one piece. I think you might also be referring to what could be eligible as a quality improvement goal that you want to develop and submit. And so when you get to that online activity, it'll guide you through the elements of how to design and draft that. It's a fillable kind of form online, and you can outline and draft how to develop a goal. Now, just attending a rounds may not necessarily meet that requirement. It's a goal, a QI goal, and what we've outlined is based on SMART criteria that we've outlined during the presentation. It sounds like some of the activities that you participated in pre-COVID are activities that could be incorporated into a quality improvement goal. attendance in and of itself at a rounds or a meeting is likely not going to meet that requirement, but again, could form part of developing a quality improvement goal. Does that help, or does that
Yep.
help?
Like I was saying earlier, so I haven't received, I guess like I was saying yesterday, I filled the initial questionnaire. So I guess I'll be getting something in the email for going to the next step, right? Would that be right?
Yeah,
And then,
correct. And maybe Dr. Manno, do you want to
Sure.
advise on
If,
process?
if I understand correctly, Dr. Badan, it sounds as if you were concerned because when you filled out the QI survey, which is the one describing your particular practice,
Yep.
You may have wanted to alter one or two of the answers. Don't be overly concerned about that. That just gives us a kind of an overview of where you practice and the type of practice you have.
Okay.
I would just encourage you just to move on now to the LMS, the Learning Management System, and just move on to the next activity. So in the chat, we could also, I see that our program manager, April Jacobs, has now included the telephone number and the email address that you can call if you'd like some assistance with how to move through the various elements of the program.
Okay, great.
So feel free to either telephone or email, and one of our QI team members will get back with you. They're very helpful in answering more specific questions.
Yeah, that's pretty helpful. Thank you.
You're welcome.
Yeah, and I think just looping back on the chat, it looks like there's been some recent notifications for selection, and it looks like it's maybe some clarity around the next step. So again, I think we've tried to answer that, but I don't know if Dr. Manno or April, if you want to just reinforce kind of next steps for someone who's been selected.
Sure, I can go ahead and answer that. So for those under 70 who've received your invitation to do QI for 2023, the first most important step ahead of December 5th is to go in through your member portal, through your quality improvement tile, and select your preferred deadline to complete all the activities. Of course, if you have any difficulty with that, please don't hesitate to reach out to any one of our QI staff. They would be very happy to help you with that. Once your deadline has been selected, you can autonomously go through and start with the first step of the program, which is the QI survey, followed by the practice profile, the self-guided chart review, and the data-driven QI activity. In your QI homepage, you'll note that there's a QI program overview that quite literally lists step by step what the sequence of activities is. And of course, I can't reiterate this enough. We're available to you via phone at extension 648, 8 a.m. through 5 p.m., Monday through Friday. Please don't hesitate to give any one of us a call. You're more than welcome to reach out to myself, Dr. Manno, or Dr. Everson directly via email. And of course, you can reach out to the entirety of the QI team at quality@cpso.on.ca.
Great. Thanks, April. Just does that help? Is there any additional questions around that, the next steps and process?
No. Thank you.
Okay. So it looks like there's another question in the chat. What are you expecting for participation from retired physicians who wish to maintain their license for teaching or other purposes? So I think, we would encourage you to connect with us directly to discuss and better understand your particular situation in terms of current state and what you're planning to do with your plans. We have experience with, with this over the past few years of the program and what physicians may be intending to do and how best to support what they're planning to do while meeting their quality requirements. I think there is a lot of nuance there. And so I think that people in a transition, there's some different factors that would contribute to what would be the best path for you if you were, potentially if you were not planning to be in any more clinical practice, then we would want to understand that. If it's a transition and a change, but you want to maintain your active license, that's another path to take. But it's just there's so much nuance there. I think it'd be easiest to connect with us directly and we can provide guidance on that. So retired physicians, so in terms of participation on the QI partnership program, you need to be in active clinical practice at your organization to be a participant on the within the QI partnership program. Again, there's nuance there depending on being a retired physician at a hospital and what your credentialing or privileging category is. Again, it might be easiest to connect with us directly so we can understand your situation.
There's also another question from Dr. Bernoulli in the chat that might be relevant for many people on the call today. What is the next step after submitting the QI, presumably practice improvement plan? Do I expect a report from the college? So I'm happy to answer that, but Dr. Manno, do you want to answer this one?
Sure. Once your practice improvement plan is submitted, that would be assigned to one of our 10 QI coaches for review. And you can expect to have a response in a timely manner. But I do want to point out that for those who have selected a date for completion, let's say in October 2023, if you choose to submit your practice improvement plan well in advance of that time, it will not be, it's unlikely that you're going to get a response until your completion date has arrived and within a number of weeks thereafter. So just a little caveat there for those who are keeners and anxious to get that PIP submitted in advance of their chosen completion date. Is that helpful? April,
Thanks,
do you
Dr.
want to say
Manno.
anything else about that?
Yeah, I would just add to that that wherever reasonable, depending on participation volumes, if you are among those members that have originally selected September 1st as a deadline, and then just because of the variability of our world now, opt to submit your practice improvement plan early, rest assured we don't penalize you for that. We thank you for your proactivity. And wherever possible, we will move you up in the queue. So change your deadline to an earlier deadline in the year to ensure that your practice improvement plan is reviewed by a coach earlier to help support you with next steps and outcomes.
I guess we should also just add that everyone participating in the program can expect to receive a written response and feedback with respect to their practice improvement plan. I see we have another question. Go ahead, April.
There's another question that I think was a little bit earlier, so we'll go back up from PJ. For a trainee who is currently doing a joint research and clinical fellowship with only minimal patient-facing component, are there differences in the QI for individuals' participation requirements?
I can respond to that. The requirements are the same, but the way that they're achieved is going to vary depending on the type of clinical work that an individual is doing and their setting. So for guidance with that, I would encourage you to reach out and ask to speak to one of the medical advisors, either Dr. Everson, myself, to discuss your particular situation, and we can help you figure that out.
Thanks, Dr. Manno. And there was one from Eagle Ridge asking if there's any way to extend my date of completion as the date offer are a little bit closer than desired. Yes, so I can answer that. There's a few different options available to everyone who's been invited to 2023. The first one is please don't hesitate to reach out to the QI staff at any time as you approach your deadline, or even immediately after you've selected one and have changed your mind to request an extension. We offer 30-day extensions to anyone who will ask for one to help support you to engage in the QI program. All you need to do is call, reach out by a portal message, or send us an email, so please don't hesitate. And the other component is just given the dynamic of the clinical landscape out there right now, if for anyone that has been recently engaged in the QI program who has yet to be offered or requests a deferral to 2024, that is available to you up until December 5th. So if there is any change you would like to explore in terms of extensions into 2023 or deferral to 2024 if you are eligible. Again, please don't hesitate to reach out to us.
Thanks, April. We just have a few more minutes for any remaining questions or clarifications. All right, I think it doesn't look like there's anything else right now. So we'll wrap up. Thank you to everyone for signing on to the webinar today. Hopefully you found this valuable in terms of the information that was shared and presented. Again, this session was recorded. It will be posted on our website under our quality program page, and as well it will be saved to our CPSO YouTube channel, where you can also view prior recordings. So thank you for attending, and hopefully this was helpful. Thank you to our guest presenter, Dr. Schneeweiss. Again, the Ideas program sounds like a fantastic program. I think it'll really is a great resource and introduction for physicians interested in doing quality improvement in terms of understanding the nomenclature, the tools, and really translating that with a practical approach. So thank you again for that. It's a fantastic program and aligns really well with what we're hoping physicians will do within our quality improvement program streams. So thanks again, everyone. And with that, we'll finish up. And thanks for attending and have a great day.
Thanks, Ted.